everybody, welcome back to the channel. I'm your girl Shawi, and from previous videos you would have seen that I'm actually positive for COVID-19, and 2 days ago I started to have shortness of breath, and today I'm actually having pain in my right leg, in the calf area. So I'm now in accident and emergency department. I have that checked out. So I'm waiting for the doctor at the moment. I've already been seen by one doctor who referred me here. So I'm just waiting for my diagnostic test to be done, essentially, because we want to rule out deep vein thrombosis, because one of the complications of having coronavirus is that you can develop blood clots, and that's definitely one of the no-nos. We don't really want that to happen, so I'm here to rule out all of those tests to see if I actually have clots, and for further assessment as well. So stay tuned. Okay, so you realize that I'm not at the hospital anymore. That's because this video was done, that video was done 2 days ago, and I didn't complete the update because I really wasn't feeling that well, and I had a lot of stuff, procedures to do, so I didn't get to complete it on that day. However, I'm at home now, and I wasn't hospitalized or anything, because basically they were checking to find out if I had blood clots due to the fact that I started to develop calf pain, and it was only in one leg, and you know having coronavirus can actually put you at risk of getting blood clots, because the virus itself, your immune system is trying to fight off the virus, and in doing so, somehow the body develops blood clots. I'm not going to go into any pathophysiology or anything like that. And also, there are other things that can put you at risk of actually having blood clots without even having coronavirus. And the fact that I'm actually ill and not ambulating, not moving around, doing the activities that I usually do, then that puts you at a risk, because you're lying down all the time. And when you're lying down all the time, not moving or anything, the blood can pool, and and cause blood clots, as well as the appetite, because my appetite has changed a lot. It was well, it's coming back now, but during that time, I wasn't eating much or drinking much. So if you become dehydrated, then that's a risk for you getting blood clots as well, because the blood is not circulating as should, because you're not taking in enough fluids and all of that. So that can lead to dehydration, and then the dehydration can actually cause you to have blood clots. So after I started having those calf pain, I know definitely that it was something to be checked out, and which which I did, and they did their test, and there was no evidence of blood clots or anything. And as I said, currently I'm back at home. As each day go by, I think I'm feeling better each day. Yes, I feel better each day, although I'm still a bit weak, and I get fatigued whenever I try to complete any activities of my daily living, like eating, not eating, like cooking, and like trying to get my hygienic needs met. I tend to get very tired in between. So I went to cook not too long ago, and after I did so, just simple stuff. I make local rice and local corned beef. That don't take any time, and in doing that, it's like I'm feeling so tired, so fatigued, that I had to come and sit down. I had to be sitting down between activities to rest in between, because my body is still feeling weak, you know. But thank God, I'm not really having any shortness of breath or anything like that. It's just that I'm feeling fatigue after activities, which is a part of, having the virus too. You get fatigue. So, but with time, I know these symptoms will go. I'm hoping they will go and that there will be no further complications or anything like that. Um, yes, so I've been seeing the comments, and I know a lot of you have been wondering what's going on, how I've been doing, and yes, I saw your comment, Keisha Jones. I see everybody comments. Paula, all of you. So this video is basically to give a little update of what is going on, and I must say that during all of this, I'm like, there are so many phone calls coming in on WhatsApp and so many text messages and so forth. Everybody is trying to get to me at once, and all the YouTube doctors and nurses and Facebook doctors and nurses, everybody. They will let were encourage me to eat and drink and this and that. I appreciate it so much. I do, I really do, because even though yes, you're a healthcare provider and all of these things, when you're a patient, when you're sick, you're actually sick. You want somebody to take care of you. And I read all the comments and I appreciate it. And even though yes, I know what to do and all of these stuff, I wish somebody was here to help me to do it. So reading the comments, it actually, you know, it helps me to make the effort more, because there are times that when I just don't feel like eating or drinking or doing anything, and I'm like, oh my God, I can't allow this to take me over. I need to be up and running again. He has good comments and suggestions, and I've been listening to them. Trust me, I've been taking part, because I have to do this, and believe it or not, if I didn't do this, then it's not like there's anybody else to do it here for you, and they will not hospitalize you unless you're pretty much dying. So, and that is what I learned in all of this. So as I say, I've been trying to keep myself distracted, because when I was getting so many calls, I'm like, oh my God, everybody's telling me to rest, but they're not allowing me to rest. There's so many calls and text messages. And I'm like, let me go and watch Bridgerton. I hear everybody talking about Bridgerton, and my best friend Sanjay was the first one who told me about it. Say, look, shall we go and watch Bridgerton? Oh God, probably was not the best idea to watch at the time I was having shortness of breath, because whew, yes, but it was a good distraction, guys. So those who have not watched Bridgerton as yet, you can go ahead and check it out. It's a good series. It's pretty good. Only if you're of age, okay? Yes, so as I said, guys, I've been feeling better each day. I have to give God thanks, because the appetite is coming back, and I'm no longer having shortness of breath. Thank God. I know I don't have any blood clots, and I'll be fine soon, So I thank you for all the prayers. Thank you for all the well wishes. I do appreciate it very much. And I just want to say I'm your girl Shawi. Thank you for watching. Peace out.